Hola, soy Mónica Sierra. Yo trabajo en el Instituto Nacional de Cáncer de los Estados Unidos y estoy feliz de estar aquí en IPVC y estoy muy entusiasmada de aprender todo lo que va a pasar aquí en la conferencia. So my name is Mónica Sierra. I work in the U.S. National Cancer Institute, and I'm really excited to be here and to learn a bunch of things in the conference.
Oh, thank you, Monica. Hi, guys. My name is Chemtai Mungo. I'm an OBGYN and assistant professor at the University of North Carolina. And I am from Kenya. I'm in Kenya. And I love this conference. It's my favorite HPV conference. I always learn a lot. This is about my fourth time attending. And yeah, really excited to be here.
Hi guys, I'm Mariano Molina. I'm a postdoc at the Cancer Center Amsterdam and Amsterdam UMC in the Netherlands. And I'm also excited to be here. A lot of basic science in the conference. Y claro, soy de Panamá, estoy encantado de que todos estén aquí. He conocido a varios científicos de alta excelencia en el mundo y eso ha sido grandioso. Espero que disfruten el recap de hoy de la conferencia.
Cool. So, Mariana, what has been a highlight of your day today? What are some interesting basic science talks you've been at?
So actually, there were like 3 workshops of basic science today, and they were all amazing. So each one of them have their like particular highlights, I think. So I think from the first one there was this nice highlight of like about a talk of E8 and E2 transcript that had a very important role in papillomavirus pathogenesis. I think that was very interesting. Another talk from John Dorbar was very interesting about like this immune control during the disease and how there should be a balance between cell immunity, HPV persistence, and other factors in the host. And the last workshop was very interesting. We're showing like some models, like mice models that you could look into for the disease, and also some organized models to look at like the bacteria and so on. So that was very a highlight for me.
Interesting. I have a question. Did they talk anything about biological aging?
No, I think none of them, I think, cover biological aging, but I think that's very nice to cover, especially for these nice models that they're developing. Yeah.
Yeah, John Dobar, who's a virologist in the UK. Is he based in the UK?
Yeah.
Yeah, he's doing really exciting work around understanding. So, as a clinician, amongst women living with HIV who I care for, we see a lot of HPV persistence following precancer treatment, and it's very difficult to understand why. And John Dober is leading some really exciting work trying to understand these reserve cells, deeper in the cervix and the crypts that might be reservoirs of the HPV virus that perhaps our treatment methods are not getting to. And perhaps amongst women living with HIV, there is less of an immune reaction that usually would work towards kind of immune mop-up is what immunologists call it. But his work is really at the cutting edge of trying to understand a big clinical problem that we as clinicians face, where you have a woman living with HIV who has pre-cancer, who's HPV positive. You treat them, and then if you remove the tissue that's diseased, but they continue to have HPV, and then the question is why. So I really I've enjoyed his talks and trying to understand kind of the molecular aspects of that.
Yeah, it's always interesting, like when in his talks he brought like these animations of the life cycle and the pathogenesis. Like it's very understandable for a basic scientist, a clinician, and I don't know. It's really exciting to look into that. Always, last year it was the same. This year it was amazing.
Yeah. For me, a highlight of mine was a session I just came from on the vaccines. So I think there's definitely more vaccine work in this meeting compared to screening or treatment. So, the WHO elimination has three pillars: vaccinating girls and boys, and then screening young women, and then treating everybody who is found to have precancer towards elimination. And there's some really exciting vaccine work, including the data that now one dose of the vaccine is enough to give young girls and boys immunity. And in Costa Rica, they've done studies that they've followed this cohort for 20 years now, and the level of immunity continues to be adequate with just one dose, which is really, really incredible, because traditionally we began with 3 doses, which is expensive. It's hard to vaccinate, especially in low resource settings. One vaccine, even if it's $45, that's $150 for one person to be adequately protected. And if the GDP of a country is $500, it's hard to ask for, a fifth of that.
Yeah.
So now there's very, very good evidence with 20 years of follow-up that show that just one dose is adequate protection. And I think that is like one of the best gifts that science can give young girls and boys. And hopefully countries can really embrace that and, get those shots to these girls and boys, because, in 30 years, when we're a little bit older, we might just not see cervical cancer anymore, which would be incredible. Yeah. How about you, Monica? What are your highlights?
Oh, a lot. And you just touched the same session I was in.
Yes.
And I work also in the single dose HPV vaccine trials in Costa Rica, so I was very excited to see all the work that has been done for the group from like 20 years of work.
Yeah.
And now see the results of that. So I'm really excited to see that WHO did this recommendation that is off-label, but it is a lot of countries, 60 countries now
have already adopted
it.
Exactly.
So people are really moving fast. But one of the things that was for me the highlight is the challenges of implementation. So there were one of the ones today, specifically in the afternoon, was like the clear messaging that we're giving about vaccination, so that more people get vaccinated. The models have shown that if we vaccinate girls is where we have the biggest impact in public health in terms of cancer reduction. So it will be very good if more countries get one dose. And hopefully the science and everybody continues to monitor that. If that we can move that way, more people get vaccinated. And today, I was in all of the public health talks. Everybody was touching about it a little bit. And my second highlight was a speaker from the U.S. that said, every woman needs to be screened. Poor women need to be screened.
That was Jennifer Smith.
For cervical cancer. Because they were talking about a lot of the inequities that exist. Because not everybody gets the vaccine. Even high-income countries get the vaccine, but then not everybody in the high-income countries is getting vaccinated. And if they get vaccinated, not everybody's getting screened. And so how do we do that for everybody, every poor country, and low and middle income countries? Women in there also deserve to be screened and vaccinated. So I was very excited about the whole thing. I was passionate.
I really loved that point. In one of the other sessions, there was a debate on whether elimination can happen, and Mark Einstein, who argued for this, elimination is possible, he made a really good point, which is similar to what Jennifer Smith was saying, that really cervical cancer is a disease of poverty. Both in the United States, in low resource countries, in Kenya, for example, if you're upper class woman, you have access to a gynecologist. But the women in the rural areas who are poor don't have access because the health system is not strong enough. And similarly, in North Carolina, where I work, in the rural areas, you see the same inequities. Women who are immigrants or very poor, just don't have access to prevention tools. So even in high-income countries, it's the poor women who are not getting these tools. And one of my mentors and a big person in the field, Grossbeck, said that the underlying condition is poverty. And really that's true. And I think that we need more discussion about that and how we as scientists can also be advocates, to make sure that there's equality and equity in how these tools are available.
Could I ask you a question about, I missed your presentation this morning and I was just like very sorry because I was in the...
There's so
Could
many
you
talks.
give me like the biggest highlight of your work?
Yeah. So this is a talk I gave at the workshop, right? Basically, it was more around the different strategies for screening.
Okay.
So it was reviewing how high-income countries approach cervical cancer screening, middle-income countries approach cervical cancer screening, and lower-income. And, it's really just driven by the epidemiology. So remembering that, HPV infection is very common early on at sexual debut. So you don't want to use an HPV test to screen young women because it's very common for young girls to have HPV. And then later on, you're using so the pap smear, cytology, genotyping to get closer at getting pre-cancer. And again, we talked about the challenges of the areas that have the most cervical cancer not having access to the best tools because of not enough investment in healthcare.
Right.
And Jennifer Smith mentioned that in her talk, making sure health insurance is a right, not a privilege, right? To be able to get good healthcare, because scientists, you guys, basic scientists, can have really good evidence and data, but if the assays are too expensive or people don't have health insurance, then they don't get the prevention. I'm curious, working in the vaccination trials, that's a lot of work to enroll people 20, 30 years ago and follow them consistently. What's that like, and what's the workforce that we see there is the beautiful results on the screen. What is it like to put all that together for a long period of time?
I have been very lucky to be able to work with this group, and the people in Costa Rica deserve all the credit because they are the ones doing the work, have excellent relationships with the participants. They take their time to explain what the studies are about. And people can tell you, I know them, and I do, they explain the study to us. It's fantastic. They're amazing. And so the success of the work in Costa Rica is because of all the people that work there, and they believe in what they do. Costa Rica believes in vaccination, which is a different issue in other countries. The vaccination rates are super high.
That's excellent.
And the team is excellent. All of them are just fantastic, and I love to go there.
So tell them thank you on our behalf, and the behalf of all the young girls and boys whose lives really will be saved because of the research that they did.
And they are very altruistic. They believe in that. They believe that they know, because it's a lot of strong community presence. And so they are communicated back as well. Like, we found we found that for the first time that one dose might work. So when the bigger trials started, people had knowledge and ownership of it, and
they're proud of it.
Exactly. It's just a fantastic. And it's happening in Latin America, which, being Colombian, I'm really excited that a lot of people, I come from a low middle income country, and I have seen people dying of cervical cancer that nobody needs to die for that. So knowing that we have the tools nowadays, that this disease could be possibly eliminated. Hopefully my lifetime.
Yeah, exactly. When we are old 60-year-olds, we can remember this.
We are all contributing in different ways.
Yeah.
Yeah.
It's What are you most excited about from a basic science perspective in the coming, years in the field?
So I'm just a little bit commenting on the vaccine as well.
Yes.
It's like it's amazing how these studies are coming up that can not only prevent cervical cancers or all
Yeah.
HPV-related cancers. So it's something that I always tell people like that you really have to get vaccinated, and it's really probably the only vaccine that actually prevents cancer. And I always say this to people, to friends, to everyone in Panama, that every time that I go there to really spread the word, because it's needed. There has to be a way to make people aware of this, and to really reach out to everyone so everyone can get vaccinated. But as a basic scientist, so my work right now is focusing on non-invasive sampling, like using urine. So my group in Amsterdam with Professor Renske Stamborhen, she's looking at different markers in urine, like methylation markers, RNA markers like microRNAs, and we are now looking at other markers like tRNAs. And we hope that we found markers that can really differentiate healthy women from women that have HPV persistence or precancerous lesion, and we can use these tools eventually as non-invasive methods to detect the disease, especially in low and middle income countries where we need to be able to screen women, and having these non-sampling methods that you can actually take them at home.
At home, exactly.
Then it would be amazing. So
Yeah.
hopefully we get there.
Well, we
fantastic.
look forward to the big breakthrough from your lab. Thank you.
Thank you.
Thank you.